So President-elect Donald Trump says he is determined to make America healthy again. And he is expected to give Robert F. Kennedy Jr. a major role in his administration's health care policy, despite the fact that he is not a doctor and has had some very far out and some controversial opinions on science and medicine. Physician and wellness expert Dr. Mark Hyman has worked closely with RFK Jr. and says, fear not. He says that Kennedy's appointment could actually be a very good thing. Why? And what does he think this country needs the most when it comes to our health? Let's ask him directly. We've got co-founder and chief medical officer of Function Health, Dr. Mark Hyman. He joins me live now. Dr. Hyman, it's nice to see you. You have said you see positive signs of change with Trump and RFK. When it comes to health. You think this could be a good thing. So many people are skeptical about it. Why do you think it could be good?
Well, you know, chronic disease is not red or blue or purple. It's a human problem. And we are suffering the greatest epidemic of chronic disease in the history of humanity. In America, 6 in 10 of us have chronic illness. 51% of children have some type of chronic illness, including obesity. This is unprecedented. We're seeing rises year over year in chronic disease. Heart disease up 50%, cancer up 30%, but 60% in those under 50. Autoimmune diseases up 100%, Alzheimer's up 150%, allergies up 200%, autoimmune disease. It's incredible. And pharmaceutical use has gone up double that. So 300% increases in pharmaceutical use for all these conditions. So something's broken and wrong with the system. So I believe that our chronic disease crisis is a national emergency and should be caused by such as the president. You know, I'm not right wing or left wing. I'm for the whole bird. Otherwise, you're flying around in circles. And I think we have this historic moment where there's an alignment in the country and people are caring about chronic disease, particularly after the COVID epidemic, and want something done about it and are sick and tired of being sick and tired, and understand that there's a moment where we can bring together the country around a common goal and fix this problem. You know, I co-founded Function Health, which is a company that allows people access to their own health data, to democratize health, to give people access to health data and their information, to understand their biology and improve their health by understanding what's going on there. And it's never been available before. It's for $4.99, $1.37 a day, people get access to over 110 biomarkers. It gives them an understanding of what's going on underneath the hood. And you know what we're seeing in our population? Of over 20 million biomarkers we've done, we see this as a sick population. 93% of us are metabolically unhealthy, and it's not going to be solved by a new drug like Ozempic.
Well, that's one thing I wonder is people are so freaked out by RFK and what's going to happen. And he talks about the fluoride going out of the water. But I mean, we're such an unhealthy population overall as it is right now. And there's so much disease. My thought is, why not be open-minded to it and see if maybe they can, you know, change things for the better?
Yeah. I mean, listen, there are tremendous forces that are making a lot of money from doing things that are making Americans sicker every day. Our food system is polluting us. Ultra-processed food is the #1 killer in the world. Kills over 11 million people a year globally. This is something that has to be addressed. And, you know, Americans are paying for this over and over. They're paying for the support of commodity crops that are turned into processed food. They're paying for those foods with SNAP dollars. $125 billion a year is for food stamps or SNAP. Most of that's for soda and junk food. We then pay on the back end for Medicare and Medicare. This is a problem that has to stop. So there's going to be tremendous forces pushing against this. But I think there's an opportunity to actually address this and reduce our healthcare costs dramatically. We probably are spending $2 trillion extra every year that we need to spend because 80 to 90% of the diseases we are seeing today in America are caused by our lifestyle, predominantly our diet. And that needs to be fixed from the field to the fork. And we have that opportunity now.
Yeah, you mentioned Ozempic. We're learning more about the possible health benefits now, but I want to play something that you said on Chris's podcast. I think this is back in 2022. Take a listen.
It's easy to want to take a pill or an injection to solve a problem without addressing the real issue, which is our food system.
So you're not prescribing Ozempic?
No, I don't need to.
So you said you weren't prescribing Ozempic then, Dr. Hyman. I mean, we read every day. It's like there's a new health benefit. It seems like Alzheimer's, cancer, the list goes on and on. Have you changed your mind on it?
100%. 100%. You're right. When you lose weight, by any means, you will reduce your risk of every single chronic disease, from heart disease to diabetes to cancer to dementia. It's not the drug, it's the weight loss. And the data is clear on this. In fact, losing weight through diet actually has more benefits in many biomarkers, for example, inflammation. And so it's not the magic of the drug, which comes with a lot of side effects. I mean, there was an incredible article years ago in the New England Journal of Medicine that said, be sure to use new drugs as soon as they come out before the side effects develop. And we're seeing that these drugs are not without side effects. Half the people who start them are not taking them after a year because of the side effects or potentially the cost. And it's going to bankrupt our country. We're going to spend $1 trillion on this if we, supply this to the American population through Medicare and other insurance companies.
Yeah.
That's going to go to Denmark. Why not invest that money in America and reform our food policies and get America healthy?
But I get that you're saying it's actually the weight loss that's the health benefits. But I look at you, you're an in-shape guy. I mean, you look great. You look like the kind of guy to me that probably eats right and it all kind of comes easy for you. But there's a lot of people out there that just can't. It's just so hard. They can't resist the temptation. I mean, who would you prescribe Ozempic to? Is it good for some people?
You're 100% right. You're 100% right. The problem is we live in a toxic food environment where the bad choice is the easy choice and the healthy choice is the hard choice. That needs to stop, and that can be stopped with policy. It has to come from the top down because the food companies and the fast food companies and the junk food companies are not going to make those changes. So it's really up to lawmakers to take care of their citizens, which is they've abdicated for a long time. And I'm excited about this opportunity. And I said I'm not right wing or left wing. I'm for the whole bird. I think we have this moment where we can come together as a country and address this chronic disease epidemic. And people need to understand what's going on with their biology. They need to understand their health.
I'm still obsessed with the Ozempic thing, though. So you're not budging. You're not budging on Ozempic. It doesn't sound like. You still say you wouldn't prescribe.
It's okay. It's a tool in the toolkit. Surgery is necessary sometimes. Drugs are necessary sometimes. It has a use case, but it's not a panacea. If we were to supply this to every person who's overweight or obese in America, it would cost us $5.1 trillion. Even if that came down in half, it's still an absurd amount of money. And it's not necessarily the right solution because we have the science that's very clear that even a diet like carbohydrate restricted diet, ketogenic diets, Virta Health has shown this and documented and published in the Diabetes Journal and many other journals, that comparing it to Ozempic, there's no difference in the outcomes. In fact, there's some better outcomes using diet alone. So I think we have to come to terms with the fact there's no easy fix. It is a tool, but it's not the answer. We have to fix our food and healthcare system from field to fork, and that's the answer for America.
Hey, thanks for watching. Go to joinnn.com to find NewsNation on your screen. And don't forget, click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.